Hello, everyone. Welcome to our TALAHour. Thank you for joining us on this very hot July day. I hope you are indoors and staying out of this heat. We are super lucky today to have Lori Tamayo with Lori Tamayo Consulting and Management with us, talking about securing data. We will be using the chat function for questions. So if you have a question, just please put your question in the chat. Also, just remind everybody that we are recording and that I will be sending out the presentation and recording afterwards. And with that, I'm going to turn it over to Lori and let her introduce herself. Lori, take it away.
Well, I appreciate your letting me present, and I've been consulting and managing assisted livings, nursing homes, home health, hospice agencies, and rural hospitals since 2009. And so I probably know a lot of the people on the webinar, but this is not an area of expertise for me. It's actually an area where I had a terrible scenario occur, and I wanted to be able to share with people what happens if you get hacked or you get a ransom. I'm not an IT specialist. I just know enough to tell you, hey, this is what you need to worry about from an operations point of view, and get with an IT specialist to help you if you don't already have one. But my experience was one of the rural hospitals that I helped that has an assisted living, a nursing home, a hospital, and 3 doctors' clinics. They got a 2 a.m. call from one of their staff members saying, the printers are spitting out, you've been hacked and we have all your data. And basically the situation that ensued for a month after this, by this hack happening and then all the data being ransomed back, was exactly like what you would see on a television show, like with a kidnapping. It was very, very similar. And so what we're talking about today is I'll interject some of the stuff that happened there, because it interrupted their operations for 2 solid weeks. And then for several months afterwards, there were still things occurring. And it made me realize, wow, I never thought about all these things that we should have done and what should have happened. So they experienced that, and I learned a lot from it, and I want to pass that along. So 60% of all targeted attacks happen to small to mid-sized entities. I always thought it was like large corporations or something of that nature, or very big companies, but it's not. It's about anyone. And what's interesting is, in the gang environment, you know how you have to level up to get into a gang. It's the same thing with hackers. Hackers have to start small and prove themselves, and then they can actually level up to where they can take on bigger hacking projects. I guess that's what basically I learned from this. Most of the breaches take only minutes. They're in. Passwords are stolen or exposed in nearly half of all data breaches. And there's a lot of phishing campaigns targeting employees. I've had several of the facilities that I work with that get those email gift cards, you know, hey, I have a surprise, don't tell anybody, go get these gift cards, and then basically we can do an employee appreciation event. We've had several emails like that go through that employees fall for. Or it's time to change your password, and you go in and you click this link and you change your password, and then they have your password. And lots of just different things being emailed out that appear that it's coming from your company by them either mimicking or cloning your email and sending out information that then has a link in it that then gets into your server or your system or corrupts your hardware. So the things that you have to look for is understanding your systems. A lot of times we have a lot of computers all throughout our facilities. We don't know where they are, what they're hooked up to, and what all we're storing. Having good risk analysis done, backup rules and setup, There's something called SIEM, which I'll talk a little bit more about, having good policies and having training. So knowing what is being stored where, how data is being collected and created and stored, what server it's attached to. Sometimes you have multiple servers, what networks it's attached to, is it in the cloud, those kind of things. Having a good inventory of not just your hardware, but your software, and knowing every device that has access to the network, even if it's an outside virtual person that's VPNing or getting into your system, you need to understand that portal as well. Knowing which printers and servers are hooked to what, and then having software inventories to know, is there any unauthorized software being put on anything? And then just knowing what's where. Knowing what's really important, what do you have out there? What are your vulnerabilities? I think a lot of us vulnerabilities and the most likely threat scenarios are, we have lower socioeconomic people working for us, like aides and people of that nature. And if they have access to your network or your computers, then they are the ones that usually fall for things because they don't have the knowledge, they don't have the IT background, they don't know about all these scams that are going on out there. So that's where you're most likely vulnerable, is somebody that has an email that isn't real educated on how to manage security. So that's why training is so important. Vendors from the outside that remote in, that are not part of your system, that's another huge vulnerability. And so those are things to consider, knowing, okay, who do I have that's probably where I'm going to get hit? Where's the easiest way they could get in? In this scenario, they actually got in with an IT person. So they fooled one of the IT staff at this rural hospital, and it was with an email saying it's time to change your password in a certain software application, that then they got in the back door from that password change into all of the systems. So we're going to talk about having different logins and different things, even for your IT and administrative people, so that they have different things for daily access and different things for your IT administrative security background access. So backups and setups. You've got to, of course, back up your systems to protect against, loss of data, but maintaining multiple copies. But how do you do that? How often? Where do you back up? What's suggested is to have a tiered system, multiple locations, maybe one cloud-based, one off-site, and they're being done at different times. Having storage snapshots and mirror images of some of your systems, and being able to have the 3-2-1 rule, which means having 3 distinct copies of your data on 2 different media and one which is off-site. In this scenario, it was what we had off-site that saved us and allowed us to get back up and running. And it's very important to test the reliability of those backups. How long is it going to take for you to restore your data and restore yourself once you get through this situation? So SIEM is what's called a security solution that helps organizations recognize potential security threats without having to sit there and monitor it with a human. It's sort of artificial intelligence that's watching everything in the background. And this is very easy. I mean, even now, since I've learned about all this, even for my business, I have all our business computers on a system that's running in the background all the time. And it basically looks at anomalies that are happening and can check, okay, we had some weird login activity that tried to happen. We had a bunch of failures for logins. And it alerts you, it emails you, it tells you, hey, you've got a problem here. So it manages people logging in and out. It manages different events that happen in your systems, gives you alerts, and it also does some compliance and regulatory auditing in the background, and it just continues to run and spit out reports and let you know where your threats might be. It's not terribly expensive, and like I say, it's a system that can run in the background. You have to have policies. Mainly having policies is just so you know what to do in the event that something does happen, or also how you're going to secure your data. And if you haven't thought it out, you need to go ahead and do that so that you have a good plan in place. So having systems in place and policies that talk about, of course, I think everybody has these on how to use the internet, how to use social media, you're not supposed to download different softwares, these things. A lot of us have those policies, but also having, how do we assign passwords and how do we assign access and who gets what level of access? Having multiple type passwords for, okay, this is for the IT person when they're dealing with security and IT stuff, but on their regular daily use to get into their email and do some of the other stuff they do, they should have a different set of passwords for that. How you revoke system access, how you shut it down whenever an employee is terminated, how you allow vendors to access your system or consultants to access your system. And then just what would you do if you feel like you've got a breach or a breach is occurring, or you get that 2 a.m. call where every printer spitting out, you've been hacked, and then you can't get into your data. And then just training and how you're going to train and do drills so that your staff, even your lower level staff, knows what to do and knows what could be a scam and what could be a phishing email and what to watch out for. So training, there is a lot of stuff, that is out there. There's some interesting things as far as there's email training data that you can send out there. And so basically they send out emails to your employees and try to get them to click the link. And then if they click the link, they have to go through a required training process of, hey, you actually clicked a link that's going to infect this computer and probably our network. You're required to go through this much more training. And so that's one way, is by real world experience and them actually experiencing what happened. Of course, your regular training programs where you sit down and you educate your employees and you let them know the things to watch out for. When you notice, of course, stuff coming through, suspicious emails, letting everybody know, hey, this email's circulating and you need to watch it. Making sure they understand how to manage their passwords and how they need to navigate the internet and all of the different things that they could actually experience. And I think sometimes just making them understand what could happen. I mean, even myself at a higher level, I didn't understand the full effect of what happens if your data gets stolen. And so helping them understand that. In this rural hospital situation, they couldn't take any patients in their ER because their radiology was on the internet. They were doing teleradiology, and so they couldn't do any scans because they had to take everything offline. All of their phones were IP phones or internet-based phones, so they couldn't utilize the telephones once they unplugged from everything. So it was a big money loss and also very difficult to take care of patients. So how do we protect ourselves and prevent something from happening? Well, of course, testing and drills. I think that's a big thing to do at least once or twice a year. And then incident response, and then we'll talk about a few of the other items in more detail. So testing and drills, you can do tabletops, you can do actual shutdown and go offline. And how do we operate if we don't have the internet, we don't have computers? How do we take care of patients? What are our downtime procedures? And doing some of the other things we've talked about, like with the email test and the backup testing. How do we communicate also is the other thing. It's very difficult for this organization whenever they got shut down because they had internet-based phones. Everybody had to use their own personal cell phones for a while until they finally got hardline phone bank set up, and they had it in a command center to where phone calls could be answered and taken care of. They were down for a day before they could get anything set up like that immediately and have it ready to go so they could still talk to the public. So it's interesting. If you have cyber insurance, that's something that in this day and age, if you don't have it, I highly recommend you get it. It helps for business operation issues, but it also helps because in this scenario, they sent out a full team of experts to help get through the scenario. It was like just like when the FBI comes out on a kidnapping case, that's what they sent. They sent a whole team of people. So if you're insured, you got to let your insurance company know. Can you bring in external resources? Sure, we had some IT people, but we didn't have that caliber of IT. So how do we bring in those external resources? Well, the insurance company luckily had that. And what was interesting was even the FBI was aware of these hackers that had hacked this hospital, but the insurance company took the lead because of their services that they offered. But do you notify law enforcement? Who has the primary responsibility? You know, the first thing that happened in this scenario was call the insurance company and call your attorney. Don't do anything without advice from either one of those. Don't do anything but unplug. Get off, get all your servers detached, get off the internet, and call your insurance company and call your attorney because you've probably got a HIPAA violation happening as well. As far as what parts should be shut down and what parts can be transitioned to backup systems, that is something that your IT professionals will walk you through. And it's a very specific process because you also are trying to make sure that you determine how significant the data breach is and how significant they are in the system. And I'll talk a little bit more about this to how they figured out how significant the hack was. So that they knew what all data did these people really have. Then basically knowing how you're going to shut things down. What are you going to shut down? How are you going to communicate with the public? Are you going to have to call CMS or HHSC and let them know about the data breach? Yes, you have to do that eventually, but get your facts straight before you start doing that. And then how do you preserve records? How do you preserve knowing what was actually impacted so that you actually have evidence? It's just like any criminal case. You have to keep the evidence. So basically they had to use organization-based emails. They were using their own emails to try to communicate back and forth, their Gmails and things like that, to try to communicate because we couldn't use the emails. His email server was shut down, and minimizing the lack of connectivity to the internet, which is what made them not even be able to communicate with their radiology provider that supplied their radiologist. Shutting down all your vendors or consultants on the outside that are using the VPN to get in, that was shut down. Nobody's going to go through a portal to get to our servers or get to anything. And then, of course, there's some other things listed here that you would go through, and you want to make sure how would you respond? How would you check everything that basically got impacted? Changing passwords, changing accounts, making sure that those things are updated, and being sure that you have dual authentication on everything. That was one thing they didn't have, was dual authentication, where you have to also get either a text or a phone call before you can get into something. So patches and updates, lots of times, and I don't know if you guys were like this, I was like this, I'd ignore my Microsoft updates sometimes, and then sometimes you have software that requires updates and I'd ignore that. Well, that's a door that you're opening that somebody can slip into, because the reason for those updates and patches is not just to help your software perform better, it also has stuff to keep people out. So it's very important that you always religiously perform all those updates on all your computers. So if you've got one computer on the network that isn't being maintained properly, you've got an issue. You've got an open door that somebody can get into. So how are you watching that? How are you making sure all that stuff is happening? Because it's not just about your computer's health or your software, how quickly it'll work or how efficiently it'll work. It's also about keeping things secure, because that's why they create these updates and patches. Passwords, dual authentication, like I talked about, that's a big thing, making sure that it's not just, okay, I enter my password and I'm in. Something else has to trigger by a phone call or a text message or something that also lets you get into your systems. Making sure that, like I had talked about before, your IT staff has 2 different types of credentials, and they only use a certain type for their IT work and the other for their general processes. And making sure that you know how you're giving access to people. Lots of people don't need upper level access. That's very, very vulnerable, because then if they're the ones that get tricked, then there's an open door there. So if something happens, what do you do and how do you contain it? Early detection, of course, the software I talked about that runs in the background will alert you many times of some possible attempts at getting into your system. And of course, your networks and firewalls will also do the alerts, and having, you know, the proper software that blocks things from coming in, and tracking unsuccessful login attempts. Those are ways to detect. Disconnect. In this scenario, they unplugged everything immediately. Everything was detached from there. And basically the quickest way to do that is not going around every computer, but is to pull it from the take down your servers. That's the quickest way to go, or shut off the switches, and get yourself contained. Your IT professional may actually have a way to where they want to do certain things in certain order. But if you don't know what you're doing, shut it off at the server base and shut it off at the switch, and get off to where nobody else can keep getting in. Get off the internet, get off the grid, basically, and disconnect. You always want to notify your legal counsel, like I said, and talk to your insurance company. And they sent out a full team. They had people that managed the communications. They had people that did the forensics. They had people that helped us keep all of the data that we needed to keep, track the loss of revenue and all these things, so that we could get paid for the business interruption of operations on the backside. And then notifying your regulatory bodies, of course, your employees, and your public and patients. What was interesting in this scenario is you start worrying, you're like, goodness, what all did they get to? And then you realize, if you realize in this scenario, they got to everything. And the way that they determined how did they get to everything was they would ask for proof of life, exactly like you would with a human that's kidnapped. You'd say, okay, hacker, Mr. Hacker, I need to see this, and I need to see this, and how, and you sometimes had to tell them how to get to it so they could show it to you if they really had it. And they did that on numerous iterations while they were negotiating the ransom for their data back. They had to ask for proof of life numerous times, and they would do that to determine what all did they have. Well, in this scenario, they had everything. They had employee payroll records, they had accounting records, they had patient files, they had everything. So you start worrying about your patients and your employees. Well, okay, if we don't pay the ransom, or even if we do, is that stuff going to get put out on the dark web? Or is all these people going to have identity theft occur? So what they did is basically they offered, they told everyone, the employees first, you need to go ahead and shut down all your credit so that no one can open up a credit card account or get a loan. And so Equifax, and there's 2 other vendors that you can contact, and they'll basically shut down anyone trying to get new credit. They also offered some LifeLock protection to their employees. They let their employees know and the public know, really look at your banking, how all your banking is set up, and make sure you have dual authentication and you have banking alerts happening so that you're able to know if someone's trying to get into your information or trying to access something because of the information they received from you. So they actually supplied that and paid for, I believe, a year's worth of LifeLock and gave a lot of public information and documents. Once it finally went out to the public, they made sure that everybody knew this is what we advise you to do, just in case there is your personal information out on the dark web. Preserving evidence, like I said, you've got to understand what's going on. You've got to know what they impacted. And then also, an attorney should always be involved in documenting the incident response because it allows the organization to assert privilege in the event of litigation. So even though we all happen to pay for attorneys, there is a good reason for this, especially whenever you think, okay, this hospital system, even though it's a small one, my goodness, it impacted thousands of lives, thousands of people's information was taken. And somebody could have sued or done something in regard to it, not to mention whatever the government might do because of the HIPAA breach. So like I said, they kept asking for proof of life. They wanted to know, what did they have access to? What did they get into? How did they get where they got to? And so basically, the common methods of spreading ransomware is the phishing emails and spam emails that are out there. And sometimes it happens where it goes into your backup systems and they target you there. They look for a specific file type and then they start basically crawling that system and attacking all of those and encrypting all your files so you can't get into them. They give you access. So there's some myths out there, that about backups and about ransomware. Doesn't affect your backups. No, if some of your backups aren't managed right, they can infect your backups just like they infected your system. Only Windows is affected. That's one that people think is out there. If you're on the cloud, then I'm safe. Well, not necessarily, because it can cross over. Paying the ransom money is easier than cheaper than investing in data recovery systems. There's no way to know that the ransom in this situation was $1 million. I guarantee you, investing in good systems didn't cost $1 million for this company, and they didn't pay the ransom. They chose not to because they had all their data at an offsite location, so they didn't need to pay the ransom. Again, like I said at the beginning, you always think it's large enterprises that get affected or somebody that's taking revenge. No, these people, they don't care. They just basically are out there doing this and it's their business. It's not personal. So it's not like a revenge or a mad employee or somebody that has a vendetta. They actually just do this for a living. And again, it's not smaller companies. It's not larger companies, it's smaller ones. Like I say, there is a pecking order to grow in experience and prove yourself in, I guess, this world that's out there. So when you get to the place where you're able to restore your data and maybe you know enough to communicate with the public, the preferred method is usually there's a mirror image that restores some of your operating systems. And you have to make sure you eliminate any vulnerabilities through any patches that are required and any password changes. But even though you've restored the data and you think everything's over, many times the hackers will be waiting in the background, just watching what you're doing. So you have to be very hyper vigilant for several months just to make sure that there's not anything happening there. And continue that monitoring process, that heightened monitoring process, not just the regular routine during that time. And public relations, it's a big deal because you don't want to just throw things out there. I mean, you want to know the facts, and you got to be sure that you disclose it properly. I suggest highly having your legal counsel work with you in writing it, and anything that you send out, whether it's electronic or in the newspaper or via Facebook post, save everything that you send out. And here's an example. This is what was given to the employees at the beginning of all this, because of course they're all aware, and you don't want them going all over town telling everybody about it until you've got a handle on what's going on. And so this is a nice little example of what was put out. You know, we experienced a network incident that is impacting some of our operations. We have taken our systems offline, and we're working with outside experts to return to normal as quickly as possible. We are open to providing care and using downtime procedures. If you have any questions about your downtime procedures, please contact your manager. Please refrain from commenting on this incident to patients, public, or social media. So that was just what was put out there to keep everything sort of contained until we could do a public comment, and that was done very publicly, and I felt like this organization did a very good job of handling how they took care of it. Lessons learned, man, they had a hard time communicating through those internet phones, so that was one thing that was very difficult. They didn't have dual authentication in place for any of their logins. And so they should have had that, especially with the upper level security, IT type stuff. There should have been dual level at least there, so that there wasn't a way to so easily get in. You know, they just looked at their policies, looked at their processes, and determined, how are we going to do things? How are we going to manage outside vendors getting into our servers, you know, because of work they're having to do, and they tightened up that process, and how long, you know, a computer could be idle and all these other things in that regard. And basically, was there any changes that we needed in our incident response? Is there anything that we could have done differently that would have helped with this scenario? And was the communication good? What else could we have done to help this process? What else could we have done to get online quicker, get back up and operational quicker? What can we put in place so that we're not having business operation interruption? So this is my information here, and of course you have your information on your TALAHour here, and I'm going to open it up to anyone that has questions. Again, I'm not an IT professional. I'm just an operator or someone that's in operations that experienced a really bad scenario, and it really educated me and opened my eyes to what threats are out there to us, and what do we do, and how can we be prepared so that we don't experience something like this. So thank you for your time.
Okay, Lori, trying to get off mute.
Okay, I'm gonna go ahead and try to stop sharing.
Well, does anyone have any questions? I'll tell you what, it is so scary, especially when you start hearing about some of the really small companies that get hit. I remember there's a local cupcake shop.
Oh, yeah.
Yeah, here in Austin, and it's like, I'm like, really? And it, you know, single location, and they got hit with a ransomware attack, and you know, obviously they had a lot of information with regards to their customers' credit cards and those kind of things. So
I think one of the local, I guess one of the beautician services that a lot of the assisted livings use, I wouldn't say the name even if I could remember it, but they got hacked. And then what happened was all these invoices were going out to all the assisted livings from this salon company. And luckily people didn't click on them and pay them, or I don't know who all did, but that actually happened in the assisted living industry about a year ago, where this group that came out and did hair got hacked, and then they were getting, everybody that did business with them was getting these emails. It was sort of scary. And I probably get one email or two emails a day where I'm thinking, or a week, excuse me, where I'm thinking, golly, this is not something I know. I'm not clicking it, or whatever. So.
Yeah, no, I probably get at least one phishing attempt a day.
Yeah.
At least. And I know that the latest thing, and this is from a discussion I had with some owners recently, and they said the use of AI has increased to where they are duplicating people's voices and using their voices to try to get authorization on payments on stuff.
Oh, really?
This is not necessarily folks trying to get your data. These are people trying to get money out of your companies, where they're using AI to duplicate voices and get voice authorizations on payments. I get submissions on payments on stuff at least once a week.
Wow.
And so in this day and age, everybody needs to make sure you're very vigilant, and that you are really looking over your policies of who's authorized to pay out money, and what are the processes and the hurdles that you set up so that people go through to get those. Because
yes,
it's scary.
looks like there's somebody with a raised hand.
Okay, I'm going to allow you to talk. Justina, if you want to unmute yourself, you can ask your question.
Okay, hello, good afternoon. Can you guys hear me?
Yes.
My question is, thank you. My question is this, I'm trying to get the license, but now that you guys were training about this hikers, and also what to do to prevent them from getting into the account, I was just wondering what can we do as a healthcare manager to kind of prevent those from occurring? Like, for instance, if they already have the information out there, they already leak it out, what can we do to prevent that from happening again?
Well, I would just, review the slides that we went over, because that's everything that you should be doing. And if you don't have an IT company, it's not like you have to hire an IT person, because a lot of assisted livings are 16 beds or 30 beds. They can't have an IT person on staff, but there's so many IT companies that even just do remote services. That's what I utilize for my company. And many of my assisted livings utilize a person that's just remote, and they put the systems in place. Pretty much takes a day or two for them to put them in place. And then I have somebody I can call whenever I'm like, is this real? This email I got, I'm very concerned. It looks like they hacked my email. What do I do? And having a resource that you can call, because you just don't know if you're not in the IT field, which I'm not. I have that resource, and I don't spend that much money on it. If I have to call, of course, there's a charge for that in addition to what they're doing in the background, but they can set you up on several different plans that can make you safer. Having your email encrypted, having the Barracuda that screens your emails, and then also having that ability to basically quarantine some of your emails helps as well. And that's not very expensive. Even like if you just look at GoDaddy, it's a little bit extra per month to do that, but that's another thing that doesn't cost that much to do. most of the time, there's IT professionals everywhere that do this kind of thing remotely, and they can help you with some of those inexpensive things that help you stay safe. Very similar to just like you put an antivirus software on your own personal computer. They sort of walk you through the steps that are inexpensive, but yet you should do it for business purposes. And then just making sure your employees know better, teaching them. This is an example of what not to click on and those kind of things. And then just review the slides. But honestly, everybody should have an IT professional that they work with, whether it's just a remote one. And everybody should really, really think about the cyber insurance. I don't even know how much it is, but I don't think it's that bad whenever you compare it to having that interruption of business services. If you can't operate, what are you going to do?
Yeah, we have an IT that we contract with that helps with all that stuff. And one easy thing, always look at when you get an email, actually look at the email address and see where it's coming from. And a lot of times, especially people that are trying to impersonate, you look at that email address and you can say, like, wait a minute, that's not coming from within the company. That's not the right email. And so, little things like that also are very helpful.
Yeah, Diane, that happens all the time. And that's we all probably know things, that we could share with each other like that. But usually the last extension piece, or there's parts of it that just don't match what you normally have. But they've even gotten better at doing some other stuff.
Your name, but then you go to that email address, and you're like, that's not my email address.
Yeah. Yeah, they actually, and it scares you a little bit because you're like, God, do they have my email? And then you look and you realize, oh, wait, they don't. They're just trying to impersonate that. So, yeah. All right. Well, if there's no more questions, I'm happy to, share my presentation. But again, there's so many companies out there that can actually do consultations with you on IT stuff. That is not what I do. I help you get your assisted living open or get whatever, help you manage your assisted living. But it's just important, I think, after I had that terrible experience as an operator, it's like, gosh, I want people to know because I wasn't prepared. I have a lot of places that aren't prepared.
Thank you so much for sharing the experience and making it very real for everyone to think about what needs to happen. And we appreciate you doing the presentation. As always, thank you for coming and speaking at conference every year and for being one of TALA's industry partners.
Thank you. All right.
And some upcoming TALA hours next month on August 18th, we're going to have workplace safety tips in assisted living from an insurance perspective. It's September 7th. We're going to have a TALA book, which is a book club that we've started. Kathy Goodwin has Love Remembers, which is an incredible book. Her husband has early onset Alzheimer's, and it is her journey of her and her family through the process of him coming down, getting the diagnosis, eventually having to go into the community. And it's a beautiful book. It's a lady, and her family and her husband are here in Texas. So it's a lot of the stories resonate because she is from Texas. And then September 15th, we're going to have a memory care dining, some demo around different things that pertain to dining and memory care and plating and finger foods and all different types of kind of different tips and hints about food in memory care. So that's going to be real exciting in September. So please stay tuned with us. You can register for all those, of course. They go out in the newsletter. We also put them up at the on the website as we get those registrations up for them, and we hope to see you next month. And everybody, as I will say, keep on saying, please stay out of the heat, and have a good rest of your day. And Lori, thank you once again.
Bye-bye.
All right.